this question, because this is really, Dr. Fuster really threw me in the hot water right there at the beginning. What are you going to do once you find it? Dan, what were you?
I missed the first part, so
What would you do when you find the vulnerable patient? Please.
Well, first I have to,
Go ahead.
I think medical therapy is terrific, so I think we have to be holding ourselves back from our aggressive revascularization. We're just starting to be getting reins on it, and we need to be much better, and I agree with Jagat that, I mean, even ischemia by itself, that's not going to be enough. So even FFR or any of the testing we do for ischemia, that's not going to be enough. You have to show medical therapy is too good. So the idea of it being a dynamic disease and something that we don't just take one point in time. You get aggressive with the medical therapy when you first find the disease. And whenever you find it, the worse the disease, then you do more testing. But you find the disease, you get aggressive medical therapy, then you have to recheck. And your concept, well, I don't know if we can afford it, but the concept of taking the patients who are at the elevated risk and then thinking of them with CTA that could be done not just one point in time, but at another point in time in the future. Quantifying the plaque, total plaque burden, the amount of calcified plaque, non-calcified plaque, lipid content plaque, and then finding out, are these plaques getting worse, is the way to go. Then when you have a patient failing medical therapy, worsening of the plaques, that's when bypass surgery becomes part of the equation, and Dr. Granville was right. So I think you get a high enough risk, it's probably not going to be focal treatments. If it's really, really high risk, failing all this, progressive disease, bypass the disease completely